Hello, hello, hello. Thank you, everybody that is showing up, that is on time on this lovely Sunday afternoon. Starting promptly at 7, and we'll give it a couple minutes for other people to join. And then we'll do some introductions. For those of you joining, please go ahead and first question, drop in the chat. What city are you joining us from? Let us know what city you're joining us from. And then also, if you want to, where you are in your process for applying into residency. The panel is to talk about matching into anesthesia. So I assume a lot of you are medical students. So let us know what year you are in medical school, whether you're first year, second year, third year. And looks like there's a question and answer box. Oh. So we have Michelle from Nashville, who's a first year medical student. Welcome, Michelle. Dr. Bakayoko from Atlanta, fourth year, currently applying into anesthesia. Oh, the chat is disabled. I'm not sure. Are we, Dr. Matthews, are we going? Okay. That's fine. Chat is disabled, but we can do these questions and answers. Kat from New York, who's a fourth year medical student applying currently. Ola from Detroit. So you guys figured out the chat was disabled and jumped right into the question and answer box. I love it. That shows you're resourceful, which is a big deal in anesthesia, as you will come to find out over the course of the next half hour, 45 minutes. We are 4 minutes into the hour, and we'll probably start in just 1 more minute with introductions. We also have John Johnson from Providence, Rhode Island, who's a fourth year, a lot of fourth years. Diana Manyancha from Houston, Texas, fourth year. Dr. Washington, fourth year from EVMS, Norfolk. Hopefully we cross paths. I was just in Norfolk for the last couple of years. Let's try and speed through these so we can start. Welcome, Dr. Green, Dr. Pina, Dr. Johnson, David Asibiote, Dr. Ship, Dr. Rowe, Ramosel. I may have bit off more than I can chew, and I probably won't be able to get through all these names before we run out of time for our panel session. Thank you all for being very responsive. We see some folks from Georgia, and I think Dr. Matthews says the chat is working now, so we'll slide over to the chat for future questions and comments. It is now 7:05. We're going to start with some introductions, and then we'll talk for probably 5 to 8 minutes apiece. You'll hear from myself and Dr. Adam Milam, and we'll be able to have some time, hopefully at the end. We will have time at the end to answer your individual questions. I will put my email address in the chat, and you can send other personalized questions if it's better appropriate there. I will introduce myself, and then I won't even attempt to introduce the esteemed Dr. Adam Milam, but I'm Stephen. I'm an anesthesiologist by training. I am a graduate of Howard University College of Medicine. I attended there from 2010 to 2014. After graduating from Howard, I attended the University of Chicago Medical Center for anesthesiology residency. I had a service commitment to the United States Navy, so I went on active duty from 2018 to 2022. I just finished my service commitment. As you may notice, I'm not quite in regulations anymore, and I started a critical care fellowship back at the University of Chicago Medical Center. I will turn it over to the great Dr. Adam Milam.
Thank you, Dr. Bradley. Adam Milam, also an anesthesiologist. I started out in Baltimore where I did undergrad and grad school there. I did a PhD in public health, focusing a lot on health disparities and health inequities, and also adolescent substance use behaviors for preventing that. I then went to medical school at Wayne State in Detroit, residency at Cedars-Sinai in Los Angeles, and I completed a cardiac anesthesia fellowship at Cleveland Clinic. Finished that in 2021 and joined the faculty at Mayo Clinic in Arizona, August of last year. So I've been there almost a year. Do a lot of research in addition to my clinical practice. Have a leadership role now at Mayo, the medical director for the Office of Health Equity and Inclusion, with the goal of really diversifying the patient population at Mayo Clinic and making sure that we are working to reduce disparities in outcomes. So happy to be here.
So as you probably know, in medicine, we are vastly underrepresented in the field in most, if not all, specialties, especially in the field of anesthesiology. What does that mean? We know the correlation between healthcare disparities and the things that we can fix with those disparities. One of those things is increasing diversity in the healthcare workforce, having a physician that looks like the patient population they serve. I'll tell a brief story. I'm in critical care fellowship. Currently, I was supposed to be in the medical ICU. I had a co-fellow that had a family emergency. I had to leave. So I got bounced over to the surgical ICU to cover this coworker. I showed up Monday, right? I wasn't supposed to be there, but I had a young brother. I'm on the south side of Chicago, who had a gunshot wound, had a trach, and was combative. He kicked the mess out of like a couple of nurses over the weekend. So now the nurses were scared and they kept him deeply sedated. So, for their own protection, which is understandable. I went in, talked to him. He couldn't really communicate back because he had a tracheostomy in place, but I, told him he was safe. He was writing notes on a note card and he kept on saying, these white people are trying to kill me. He was very paranoid. And, he woke up in a strange place with gunshot wounds to his face and to his chest. And I was able to build that relationship over that day. The next day I worked on it some more. I convinced the nurse to stop the sedation. I said, hey, we're going to stop the sedation. I'll keep him calm so we can get the x-rays needed. He's going to comply and get the C-collar cleared. Is this process of kind of rehumanizing this young man. So I sat there in his room for like 35 minutes. We got the x-rays. He would listen and work with me. So we got that C-collar off. The next day, we worked some more. We got his trach replaced. We put a passing mirror valve, which allows you to talk. From that point on, he was a new person. He's able to communicate finally. And he left the ICU on Friday. I wasn't supposed to be in the ICU, but it just, by divine appointment, happened to be there. He held my hand once he was able to talk. I stood there. He just like held onto my hand for about 10, 15 minutes. He said I was a real one, and he was my brother, and he loved me, and he thanked me because I was there to impact his care and get him further on the path to recovery. That story pretty much encapsulates why we need diversity. This is a hospital in the south side of Chicago, and in our anesthesia department, there is one Black faculty member. The need for diversity in anesthesia is great. That is why we are so excited that you're interested in this field. We're so excited that Tour for Diversity has built this panel and is going to set up some mock interviews. As we proceed towards applications to residency, we want to provide some information that is helpful and useful. Dr. Milam, as you start looking at and reviewing residency applications or preparing for the interview process, what are 2 or 3 tips that you would have for our future partners in this specialty?
I think the biggest thing is to show how you're different than all the other applicants. Everyone has great test scores and great letters of recommendation, but how do you stand out from someone else, and it's going to make me remember you when I interview you. So I think that's one of the biggest things, is really just making sure that you stand out, and then just make sure you have a well-rounded application and make sure you're a well-rounded physician in general. So are you involved in the community? Are you doing research? You play a sport? anything that's going to make you well-rounded and say you're not just 100% focused on medicine. We want people to do well within medicine, but we also want well-rounded individuals that we can work with for the next 4 years. So those interpersonal skills will really come into play. The last thing, just make sure that someone reviews all your application materials. I think that's the biggest thing. Some people just try to write a personal statement and don't have many people looking over it. So have your medical colleagues and non-medical colleagues review your personal statement, review your CV before you submit that. You don't want any errors on there. You want to make sure that it really represents you.
A couple of things I would mention. The big question right now is with step 1 going to pass fail, how's that going to affect applications? And everybody's kind of, you got to realize even on the other side that program directors are people too, and they're just as lost as most of the applicants. Obviously, their life doesn't depend on matching into residency, so it's a little different. From the program director's perspective, though, they're going to look for people that are pretty sold on the program. What's new to the match this year is signaling in the anesthesia programs. So, and I'll have to read up to see what specific signaling you can do. But essentially, when you submit your ERAS, you'll be able to put a signal on a couple of programs. I think it's either 3 or 5 programs that I really, really want to go to this program, whether it's a geographic signal or otherwise. That is a new feature that some of the different specialties are starting to roll out. And I believe last I read, which is about a week ago, that anesthesiology is going to have some signaling. I could be wrong, but I'm pretty sure I read this on their website through ERAS. That's one of the perks. People ask a lot about away rotations. I strongly recommend away rotations. I attended Howard. We didn't have an anesthesia residency program, and I did one away rotation to UC Davis. Away rotations allow you to get face-to-face with some attendings, to get to know a program. It shows other programs as you're interviewing that you are serious enough to go out of your way to schedule an away rotation to get additional experience in anesthesia. So personally, I will always highly recommend away rotations, especially now with virtual interviews. It's a way to get face time and really let people get to know you. A lot of residency matching is just finding a good fit. Program directors are scared of having a resident that's lazy, a resident that has a bad attitude, a resident that does not work well with others. And we're all very unknown quantities despite the glowing applications that we put forward. So from a residency program director perspective, being able to evaluate you and know that you work well with other people would be invaluable, especially if it's a program that you want to match at.
Just on a point of away rotations, I just want to let everyone know there's about 10 to 12 programs that will pay for minority students to do away rotations at their institution. The deadline for a lot of them probably have already passed, but there might be a couple. And so I'll share my email address. But just offhand, I know that Duke has a program, Stanford, Hopkins, Harvard, Cleveland Clinic, University Hospitals, and Mayo Clinic. But there's a list of at least 12 programs. So I would definitely take advantage of those, and they help with housing and travel. And as Dr. Bradley mentioned, away rotations are invaluable. You can get letters of recommendation, you get additional exposure, not only to the attendings, but the residents, and you get to see if that program is a good fit for you. So I would also highly advocate for away rotations.
Dr. Milam, what's the name of that school in North Carolina? You said that funds students?
Duke.
In case you didn't know, he was from Baltimore. Now you do, Duke. He mentioned letters of recommendation. So a little, surprising. I had to write letters of recommendation for the first time this past year. Dr. Miles probably I know he's written a lot of letters of recommendation. So what I figured out was, one, when somebody asked me for a letter of recommendation, ideally they have their CV and other information readily available, because I will have worked with that person ideally in the operating room, but I don't know enough about them otherwise to write a letter of recommendation unless we've worked really, really, really close together. And that's probably not the case. So I found it helpful to have that. Dr. Milam, you've written far more letters of recommendation than me. So what advice do you have for getting a good letter of recommendation?
I would say everything that you said, but you want to make sure that they're going to write you a good letter. So I would preface the request, do you feel comfortable writing me a good letter or a strong letter of recommendation? And then just everything you said, Dr. Bradley, make sure you send in your CV and your personal statement when you request that letter, just so we know more information about you. And of course, we can't share the contents of the letter with you. So really make sure that your CV and personal statement are up to date. And just a point, I tell all my mentees to update your CV on a monthly basis so that you can always send that in if you request a letter or any kind of scholarship program. And Dr. Bradley's shaking his head because I tell him the same thing, to update his CV on a monthly basis. I think that's really important.
Don't be like me and spend the last 3 weeks updating your CV so you can actually get a job. But that is my struggle. Letters of recommendation. You need to stay on top of people in terms of communication. So sending follow-up emails, it's a fine line to walk. You don't want to be annoying, but this is your future on the line. So number one, giving people enough lead time to write you a letter of recommendation. And number two, following up regularly to make sure that that letter of recommendation is being written. So one way to do that is, if it's a mentor or somebody you work with closely, try to schedule regular mentorship meetings. Like okay, we're going to meet twice a week until this date to do whatever. And that's a different way of going about it, to when you have that meeting. Oh, hey, yeah, how's the letter of recommendation? Otherwise, I tell people, you got to email me. Like if you haven't heard from me in a week, please reach out. Like, you're not going to be annoying. I just have a lot of emails and you're going to get lost in the inbox. So communication is key. And Dr. Milam says in the chat, request letters early and ask for extra letters. When it comes to anesthesia, the big question obviously is going to be why you're choosing a career in anesthesiology. As an anesthesiologist myself, some of the things that I like to hear is that you have a passion for physiology. That's a lot of what we do, physiology and pharmacology. We're scientists through and through in the things that we do when we're taking care of patients. So it's important to kind of put that side through. If you like ICU, a significant part of our anesthesia residency is spent in the ICU, intensive care, and that's what we do for our patients. So that's kind of a buzzword that, don't lie, but if you like ICU, then that's something that you can bring up, because a lot of people really look favorably upon that connection to anesthesiology. The patient relationship. So most anesthesiologists are not going to like if you say like, oh, I like this short relationship. Like, you can't frame it as like, I don't want to have a relationship with these patients. People think we just put them to sleep and that's it. You don't have to talk to them. It's a common kind of tongue-in-cheek joke. But the irony is we actually build very meaningful, trusting relationships in a small amount of time. So communication skills are key, and saying that you enjoy being able to connect with patients can actually be an asset, even going into anesthesiology. Dr. Milam, what else would you want to hear from an applicant going into anesthesiology?
So really just try to be yourself, especially in the interview process. It's really easy for us to pick up when someone's not being authentic. And just know your application really well, because there'll be questions about a research experience or a clinical experience that's listed in your application or your personal statement. We really want to discuss that. For the interviews, is really, as Dr. Bradley mentioned, to get to know you as a person and not necessarily ask more questions about your test scores and things like that that we already know about. So really talk about you as a person. And then there'll be some common questions for every interview, and that'll come across for the mock interviews that are going to be occurring. But definitely do some practice interviews before. But it's really to get to know you as a person, not just you as a clinician during the interview. And that should come across in your personal statement as well. But the things that Dr. Bradley mentioned, a love for physiology and pathophysiology, good with your hands, good interpersonal skills, because as he mentioned, you have to make a meaningful relationship within 15, 20 minutes, and alleviate the stress and anxiety of your patients, and then work with everybody else in the operating room. So it's really important to have good interpersonal skills.
The other question that comes up often is, what does it take to make a good anesthesiologist? A couple of things that are essential is situational awareness. This happens, as a resident. This happens when you're on an away rotation. As a medical student on an away rotation, situational awareness, or any anesthesia rotation, situational awareness is key. You're there to learn, but you're not directly contributing to patient care usually. It's important to be aware of your surroundings. You have to stay out of the way. It sounds harsh, but there's times where they'll be like showing you how to intubate or showing you how to place an IV or other procedure. There's other times where things can change really quickly and you need to have your spidey senses tingling like, okay, I should probably step back out of the way. When I'm working with residents, it is a test, but I will give them very straightforward, direct commands. We're mass ventilating a patient and they're doing it inappropriately. And I will say, doctor, please step out. I'm very formal with my residents. It's kind of this mystique. Hopefully we never work together because I've blown it, but I say step out and I'm watching to see, are they going to keep trying to mass ventilate this patient? Are they going to, no, I give you a very straightforward command to step out. And I do this pretty frequently because it tells me in the middle of an emergency, what is this resident going to do? What is this medical student going to do? If I give them a direct order because something, the patient's desaturating to the 50s, and they need to bring the laryngoscope out and mass ventilate, are they going to follow that direction to the letter? So situational awareness, hey, they say step back, or before something starts to happen, get out of the way. That's probably not a good time to ask questions. Know when is a good time to ask questions. If it's something that can be easily Googled, you can go ahead and look that up. And that kind of really shows that you're being proactive about your own education. There's different levels of questions. There's a very basic, what is this laryngoscope question that you can probably Google. What is the thing you use to put in a breathing tube? And then there's that tertiary or secondary order question of, how do you decide between a direct laryngoscopy or video laryngoscopy in this patient? So try to really elevate the questions that you're asking and use that situational awareness to know when is an appropriate time to ask these questions. The other thing is emotional intelligence, and it kind of goes hand in hand, and just kind of reading the room. And when you're in front of patients, it probably isn't the first time that, right time to ask, oh, can I do X, Y, and Z? You never want to put your attending or your senior resident or anybody on the spot because we need to maintain this professionalism in front of patients. Dr. Milam, what else, in your opinion, makes for a good anesthesiologist?
So just all the skills you're going to learn during medical school. So conducting a good history and physical. A lot of students will come for the anesthesia rotation and they just want to do procedures. They just want to intubate, throw in central lines, put in arterial lines. But the importance of a good HMP, I cannot stress that. And so during that pre-op interview, know your patient well, ask the relevant questions, go through their EMR and get all the relevant information and figure out how are the patient's characteristics, comorbidities going to impact the surgical procedure that they're undergoing. So everything that you learn during medical school, that doesn't disappear when you do your anesthesia rotation. So use all those skills from your medicine rotations, your ICU rotations, to make sure that you conduct a good history and a focused physical exam. Of course, physical exam will be focused for us, mainly the airway, lung, and the heart, but it's important for certain procedures, certain patient populations that you do other aspects of the physical exam. So it's important to read about the case beforehand to see the anesthetic implications and how patient comorbidities, medications could impact their care.
We are going to talk for another 2 or 3 minutes and then open the floor for questions. I literally just forgot what I was going to say. Let's see. We talked about procedures. Oh, a lot of times, like when stuff happens in the hospital, there's two reactions. Like maybe you've never seen a surgical area before or a code. You can choose to watch, or you can choose to contribute. This is true for the ward. This is true for the operating room. Realize that, okay, so your first time you've seen a cardiac arrest or a difficult intubation, then sure, maybe it's your chance to just kind of watch and see how things progress. The next time you see that, though, think about how can you contribute. You're probably not contributing if you're part of the crowd. Can you walk next door and get help? Can you find, maybe you learned about a bougie and you know what a bougie is, and you can grab that next tool. If you watch the surgical text during a surgery, you see how involved they are in anticipating what is needed next. Now, a lot of that comes, you don't have the breadth of knowledge at that level, but always think about how you can be an asset. The other thing I was going to say is there's a lot of dogma in medicine, and there's, the surgeon versus the anesthesiologist and blocking cases and all that stuff that, you should probably like not really get involved with, especially at that level. Realize that on the back end, we're all friends with our surgical colleagues. There's a lot of drama with certified registered nurse anesthetists. Don't involve or engage in any of that drama at any point in your training. Just be friendly, respectful. Unfortunately, we've all been probably talked crazy to by other members of the healthcare team, and just know, you're not a punching bag, and you do need to stand up for yourself, but be very mindful of the relationships that you're developing and building with other members of the healthcare team. Dr. Milam, what else would you like to add? Well, you just
I just put something in the chat. And so for all my mentees, before they start an away rotation, I usually have a 15-minute talk with them just about what to expect during the fourth year rotation and some of the expectations for you as a student. But I always send them a pre-op template, the same template that I use, and that'll help them present a patient, know what kind of monitoring or information that you need to include in that presentation. Also about a basic understanding of some of the anesthetic drugs, the commonly used drugs, the doses. And of course, you're not expected to know all of that, but if you do know that, you'll shine during your rotation. So definitely reach out to either senior medical students, mentors, or residents at the program where you're going to be doing your away rotation.
All right, that sums up a lot of the basic information. If there are any questions, let's go back to that Q&A box. And I think you should be able to ask questions there, and then we can answer whatever questions you have. While you put those questions in the chat, I will go ahead and plug our virtual anesthesiology journal club. So Dr. Milam, there was a couple of anesthesiologists that were going to join us this evening, but unfortunately, life happened. So there's a couple of us, Dr. John Patton, Dr. Milam, and myself, and we've been able to start a virtual anesthesiology journal club. And once a month, we get together via Zoom and review journal articles from anesthesiology related literature. The purpose this serves is we're really trying to build a community of Black anesthesiologists. We're severely underrepresented in the field. I think only 2 or 3% of anesthesiologists identify as Black. And this is kind of a time that we can come together and center on anesthesia. We can improve each other's practice for those residents that are currently practicing, for those medical students. And we get to talk, gives you access to the mentorship of 3 Black anesthesiologists, all of which are currently in academia. So to join that, it's just my website, stephenbradleymd.com, and there's a little link where you can sign up, and that'll get you on an email, and then we just send you an email with the Zoom link. So the next one is going to be next week. I think it's next Monday. So if you're interested, you can sign up. There's something else to talk about on your interviews. The other tip that I have is the American Society of Anesthesiologists has an annual conference. So every year in October, they have their conference. So it's coming up. It's going to be in New Orleans. I heard that city is not too shabby. Dr. Milam is a fan, and you can go to the conference. The benefits of the conference is there is a residency fair every year at the conference. It allows you to get face-to-face with the academic programs. The only reason I matched the University of Chicago, I had pretty average board scores and applications, but I met my program director. The first time was at the ASA meeting. It was in DC. I met my program director again at the SNMA conference. And then the third time I met him was at the ASA conference. This was as a fourth year medical student. So I put in my application. I was doing my away rotation at UC Davis in Sacramento. The ASA conference was in San Francisco. So I rented a car. I was so broke, but thankfully like the away rotation was paid for. So I scraped up some coins, rented like the smallest little hybrid car that I could afford, drove an hour to San Francisco, went to the ASA conference. I met a bunch of programs, right? Because I'd had applications in. I think I applied to like 30, 35 programs. And I went from table to table to table. I went to Duke. I went to University of Chicago. I was like, oh, hey, you know, pick me, essentially, and talked to those program directors. And the next day, my email is ding, ding, ding. And I probably got like 5 or 6 interview invitations right after that event. So it gives you that face time that, you know, whether it's an away rotation, seeing people in person at the conferences is essential to really improving your odds of matching. And Dr. Milam was kind enough to put some links in the chat to the ASA annual meeting registration. It's pretty cheap for medical students. And yes, this is going to be somewhat cost prohibitive because you do have to travel and all this stuff. But if there's any way you can ask for help, this could make or break your future career. So it is very, very a very good idea to try and go. And there's a residency fair. There may be a virtual component of this as well. All right, so I talked so long, somebody put a question in the chat, so I would stop talking. Dr. Milam, you have anything to add?
No, I think you covered everything. I think all the conferences are really good to network. So ASA, NMA has a national conference as well, and they have an anesthesiology section. They just had it last month. So also a good opportunity to network, and they have funding for students to travel there. As Dr. Bradley mentioned, the cost to register for these conferences are really low for medical students or zero. I would talk to your schools about getting funding to travel to the conference. As he mentioned, this is a very important conference to attend just because of the networking, not only with the program directors, but the residents and other people within the field.
So let's see, we have a question from Miss Felipe. Thank you so much for having us this session. Can everybody, I don't know if everybody can read this. If you guys can read this question, you know, say yes in the chat and then I won't read it out loud, but thank you for having this session. It's been really helpful. I wanted to ask, what is your opinion on receiving letters from attending who is more than willing to provide it, but mentioned that they would prefer that the student complete the letter and send it to them for edit? And okay, you cannot see the question. Okay, the question is, what's your opinion on receiving a letter from an attending who is more than willing to provide a letter of recommendation, but mentioned that they would prefer that the student complete the letter and send it to them to edit and submit? I understand that attendings are very busy and have many responsibilities to prioritize, but can it be damaging if the student agrees to do that? My personal opinion is no. I feel weird asking the student to write their own letter of recommendation, but if you best believe if a student sent me a letter of recommendation that was already kind of filled out along with their CV that I could just make edits to, it would greatly decrease the amount of time that it would take for me to turn around that letter. I'm going to read it, I'm going to make sure you're not making up stories, and I'm probably going to take bits and pieces of that letter and use that in my letter of recommendation. Dr. Milam, what would you do?
Yeah, this happens pretty commonly. It's not ideal, but it does happen. And it happens definitely at the level where I'm at now. So if I need a letter of recommendation from one of my mentors, they're asking me to prepare that letter. So I don't think it violates any of the rules. You can't see the final letter, but if you give them a draft letter and they edit the letter, put it on letterhead and submit it. I don't think that violates any of the rules. So unfortunately, that does happen. So I don't think it's a problem you preparing that letter and sending it to your attending. And it will speed up the process, as Dr. Bradley mentioned.
I just clicked on this answer live. Can you guys see the question now, or Adam, can you see this next question?
Yeah, I don't think they can see the questions. When you answer it live, it just disappears.
Oh, okay. You want to read this next one?
Oh, so for the scholarships so the next question was about ASA in October. Are there scholarships for medical students? I decided on anesthesia a bit late and the abstract deadline has passed. So there are a few scholarships through ASA, travel scholarships, and then there's certain programs. So if you apply for one of the mentoring grant awards, you can use some of that money for travel. Unfortunately, it is pretty limited. A lot of the scholarships and funds for this comes from specific institutions and not ASA in general. So I would talk to your actual institution or your mentors. Sometimes mentors can help sponsor some of the costs associated with travel, but most of the funding through ASA has already passed, as you mentioned.
Yeah, there was a question from Dr. Uche. I'm doing my away rotation in October and I will still be there during the time of the ASA conference. Should I still go to the conference or just be available that weekend at my away rotation? The program is my number one choice. As soon as I touch down at that program, I would schedule a meeting with the program director. Because number one, you'd be surprised. If you are doing an away rotation, some programs are proactive to say, hey, this person probably wants to match here, and we're going to meet with you as a program director. But understand anesthesia departments are understaffed and extremely busy across the country. And you may very well be shuffled around with a different attending each day. So as soon as I touch down for this away rotation, I would shoot an email to the program director. Hey, do you have time to meet? If you have time to meet, great, ask them in person. If not, ask via email and lay it out to them. Hey, I love this program. It's my number one program. That's why I'm doing an away rotation here. But I would love to go to the ASA conference. If you're presenting, that's fantastic. But otherwise, I would love to go to the conference. Is it possible for me to go to the conference while I'm on this away rotation? I would put the ball in their court. Nine times out of 10, I would guarantee you that program director is gonna be like, oh, absolutely, go to the conference. Because as a sub-I in anesthesia, you're not gonna miss anything if you're gone for Friday, Saturday, Sunday. You may be back Monday. I would 100% talk to them about it and be upfront because they all want you to succeed.
I completely agree. The earlier you reach out to the program, the better. And maybe, as Dr. Bradley said, you don't attend the entire conference. I think the residency fair is usually on Saturday. So if you attended Friday through Sunday, you probably won't miss much as far as the rotation, as he mentioned. And you can get the highlights of the ASA conference. But I agree that they will be more than happy for you to go to the conference.
Any tips on navigating implicit bias we may encounter on the interview trail? As people that come from, as underrepresented minorities in medicine, Black people, Indigenous, Latino or Latina, we're familiar with implicit bias. We're familiar with how we may or may not be familiar with how it manifests itself, because unfortunately we don't always see that what is happening and what is occurring behind closed doors or in front of our faces. I would focus on being the best applicant that you can be. These are going to be Zoom interviews. I'm pretty sure that there's all Zoom this time around. So if you get hung up on like trying to think about what they're thinking about, it's going to be too much for you to bear. It's that double taxation that we face as minorities trying to navigate a space that wasn't built for us. Fortunately, I like to think we are making progress in a lot of different areas, but you will encounter bias. I remember one of my interviews in South Carolina. I was in South Carolina. Sorry if you're from South Carolina. I did not rank that program because of the things I experienced, especially at the residency dinner where one of the residents' wives talked about how incredible the state was. And there's a holiday for the could celebrate the Confederacy. I just looked around the table like, okay, that chair of that program grilled me mercilessly on the interview. And I remember walking back by his office after one of my other interviews, and he was kicked back with his legs crossed, joking with one of the other applicants. It was like a completely different attitude in the interview. Unfortunately, that's going to happen. It's going to occur, but I would say don't try to kind of psych yourself out and just be the best applicant that you can be. Let's see, should we signal or not reach programs for the supplemental application? I think the question is, should you just signal for, the signaling is kind of a couple of golden tickets. So I would say, read more on the options that they have available, but I would use those wisely to some places that you really want to go. Okay, Dr. Matthews answering the chat. Yeah, Dr. Milam, would you speak on some of those inappropriate questions that are reportable?
Sure. So I think around pregnancy, marriage, things like that, age, those are questions that the PD are not supposed to ask applicants. But there are just also some inappropriate political questions that come up. I had questions about what I thought about the police brutality in Baltimore, which is a very weird question for an anesthesiology interview. And so you could try to answer that honestly, but I felt like it was no win for me if I answered that question. And so I just didn't answer the question. So you can say, refuse to answer a question. That'll give you clues. Maybe this program's not the best fit for me, but there are some that are actually reportable, and you have to look that up on ERAS. But if you get a weird question or something that you think is inappropriate, I would definitely talk to your mentors, colleagues, people who are at your medical school, because programs can be investigated for certain questions.
I don't feel comfortable answering that question. That is a very fair way. At that point, if somebody's asking you something like that, that is completely egregious and inappropriate. Their evaluation of you is not going to hinge upon whether or not you answer that question. They've already kind of made up in their minds which way they're going to go. And I don't feel comfortable answering that question. That's going to let them know that that they're out of line and they're probably going to move on. Question from anonymous attendee. How would you show your commitment to anesthesia aside from doing aware rotations or interest groups? I'm thinking of a way to stand out. Dr. Milam, you want to answer that?
So I think those are the main ways to show that you're interested, but also going to the national conferences, presenting at the national conferences, reaching out to folks within the field, I think are good ways to show your commitment to the specialty. But the minimum would be doing the away rotations and joining the interest groups. But of course, if you do research, if you volunteer at the national conferences, that's also a way to get some funding to go to the national conferences. You can volunteer at the conference as well. But I think those are the main ways to stand out and show your interest.
Dr. Bakayoko asks, what are your views on departmental anesthesia letters versus those from a specific anesthesiologist? It depends on some of the programs will require I can't think of the name, but a letter from the chair of a department. So look at their requirements for the different anesthesia programs. I remember looking through all 40 programs and essentially having the bare minimum requirements that went to every program. So if half of the programs wanted a chair letter, I assigned a chair letter to all the programs, so my bases were covered. Specific anesthesiologists, this is an important point because a lot of us are depending on the medical school you come from. You may not be at an academic program with a well-known anesthesia department. You may not be at an academic anesthesia program or department. You may have a private group that just does anesthesia. So for those, I would try to closely align myself with an anesthesiologist from that group. Go to whoever is the group liaison for that medical school they should be kind of focused on education and say, hey, I want to go into anesthesia. Can you please partner me with a mentor? And that'll assign you or link you with one anesthesiologist and work with that person to secure a letter. Next is, are we expected to ask for letters of recommendation during away rotations if they are after ERAS has been submitted? Adam, you want to answer that?
I think it's always helpful to request a letter on the away rotation. Again, as you mentioned, some of the ERAS may have already been submitted. I think you can add letters later on. But if you have all your letters and they already started sending out invites, of course, there's no point of requesting a letter. But if interviews haven't been started yet, I think it's always helpful to get a letter from that specific program and attach that to the your ERAS application for that particular program. A letter from that program will be stronger than another letter from another institution. So I think the answer is yes, you should be requesting letters for your away rotations.
And we probably have roughly 12 minutes left, but we're going to try and get through the rest of these questions. Fantastic questions, keep them coming. A quick question in the chat, it's not in the Q&A box, but the good number of total programs to apply to, all I can say is applicable to everybody. Look at the charting the outcomes data from the match. Look at your own statistics, talk to a faculty advisor or mentor, and together you can put that together to determine the number of programs you're going to apply to. Another anonymous attendee, maybe it's the same one. This is the M1 at Meharry, interested in research, particularly focused on improving postoperative nausea. Are you familiar with any summer hypothesis-driven research opportunities or any advice on how to participate in a research opportunity? Oh, yeah, that's a good way to do it. The America's, or go ahead, Dr. Milam, you want to talk about that?
Yeah, so FAIR, the Foundation for Anesthesia Education Research or something like that, they have a summer fellowship program where you can spend, I think, 6 to 8 weeks with a specific program conducting research. I think that's the main one, but hospitals, some hospitals also have summer research programs. Not all of them are formalized, but you can always reach out to the PD and, you know, see if they have any research opportunities. The FAIR is helpful because you get funding for that and you get to present at the ASA conference. But for the other programs, it's helpful because you'll get research experience and can also get a letter from your research mentor.
I typed an answer, but I basically said, look this fall for research opportunities. The NIH has a program, that's one I took part in, but it's going to do some digging. In November, December, just set aside some time to like sit down and be like, hey, what am I going to do this summer? And you can find it on the interwebs. Dr. Negata says, what study resources would you recommend for a third year or the first rotation in anesthesia? If your expectations are different for a third year, what are some ways for someone to stand out and or get honors? There's a little pocket book, Anesthesia Secrets, that's really good. Stanford has a PDF online that has a lot of basic information on anesthesia. And to stand out, again, it goes back to that emotional intelligence we talked about earlier, the types of questions that you ask as well. And tailoring those questions to the patient. Don't get hung up on procedural skills because, you know, procedural skills just come with time and practice. It's more so that to show that you can listen and follow directions, that sticks out better than somebody that just puts in every arterial line or IV they get. Dr. Sid says, thank you for this webinar. What is your opinion on anesthesia being a DO-friendly specialty? Have you seen DO applicants apply without step exams? We're told to take step exams to be competitive with MD applicants. I'm a little behind on the data. I thought we were going to a combined match system. I could be wrong. Dr. Milam, do you know about that?
I don't have much information, but I think anesthesia is a DO-friendly specialty. Of course, some programs take more DOs than other programs. I would encourage you to take step exam just so you have the same application as other applicants. But I think there are a lot of DO-friendly programs. Cleveland Clinic actually is a very DO-friendly program, and a lot of the programs in New York. And we can connect you with some of our DO colleagues if you shoot us an email.
How do you select a program? John Johnson is adding programs to a list. It's difficult to differentiate them, and they don't have many geographic preferences. Again, that charting the outcomes data from previous matches shows what people typically choose. Geographic location is pretty much always the number one thing people use to pick programs. I also chose University of Chicago because they were very heavy on critical care. Some programs will, be heavier into pain management. Some programs maybe have components of public policy or public health or other things that you may enjoy or be interested in. Also trying to get pictures of the operating rooms. We have very nice facilities in Chicago. That was one of the reasons. And we're also on the south side of Chicago, and we do a lot of trauma. A lot of trauma, and we're really providing excellent care to patients that look like us on the south side. So that's a plug for University of Chicago. And Dr. Milam, go ahead and share your thoughts.
I was answering another question. I think you answered that one sufficiently, because we have, I think, 6 other questions in 7 minutes.
Any advice for osteopathic medical students who are interested in anesthesia with step 1 being pass fail? Mentors have advised us to forgo taking this exam, but to register for step 2 since it is scored. I would defer to those mentors in your osteopathic medical school, because I'm a little out of date for that information, and I'm not a DO. So please defer to your mentors at your program. When choosing letters of recommendation to send to programs in ERAS, is it frowned upon to send 4 letters max to programs that say they only require 3 on their website? Is it viewed more as not being able to follow directions? If the program says they only want 3 letters, then that's, you follow directions. But usually it's like a minimum of 3. And so if you send 4, that's fine. What are the pros and cons of choosing a surgical intern year versus the IM intern year transitional? Which type would be the best for the clinical anesthesia years? You will be successful with any of those 3 routes. The surgical internships tend to be a little busier, but it does give you a very valuable and a different perspective on anesthesia and critical care. But they're all kind of equivocal. A lot of that comes down to location. Where do you want to live? Do you want to move for intern year? Do you want to stay at your program? Do you want something that's kind of cush? That's what I would say for that. Dr. Milam, can you answer this question from Dr. Rodriguez?
Yeah, so that's a good question. The question was about if you're not able to do an away rotation, some programs are at full capacity or aren't allowing for away rotations. I think the best thing to do is just do a rotation at your own institution and get your letters there. Again, away rotations aren't necessary, but I think they're pretty helpful for some of the more competitive programs, or if you have no ties to the particular area. But just do a rotation at your home institution, do well at it. You can also try to do other rotations that might not be as full at other institutions, like a critical care will also be helpful for anesthesiology. Or I think, critical care, I wouldn't do any other ones.
Will taking step 2 in mid-September impact my chances of getting an interview since my score won't be released until after I submit ERAS? I took step 1, pass fail. It kind of is what it is. You'll get your score back during interviews, and they'll ask you sometimes at the program. You can also update your ERAS with your step 2 score. If you do really well, that's great. If you do bad, that's not good. I did worse on step 2, so I was hoping people didn't ask, and then somebody asked, and it was one of my worst interviews. But that's me and my struggles. I'm sure you're going to do just great. But it's kind of like, you're juggling everything with life already with the application. So take step 2 whenever you're ready and whenever you can do well on it. People told me, hey, Stephen, don't take step 2 when you're in the surgical ICU working 84 hours a week. And what did Stephen do? Stephen took step 2 on surgical ICU when he's working 80 hours a week, and he did not do well. As an M2DO who comes from a newer institution which places the emphasis. Oh, wait, did it disappear?
Oh, sorry, I think I answered that.
Oh, okay. Let's see. Should I do post name? Okay. For those applying the current ERAS cycle, is it okay to not have a step 2 score by the time you submit your application? My score will be released 1 to 2 weeks after programs can start viewing residency applications. Yes, absolutely. You need to go ahead and submit that ERAS that you can get in that first wave of applications. Yeah, and yeah, don't delay your ERAS applications to wait for your step 2 score. Whew. Well, let's see. Do we have any more? I think we got through all of the questions. That was great. Really good questions. We can tell by the questions. I mean, you guys are really invested. Obviously, this is your future. Dr. Milam and I are resources. Please avail yourself. We are incredibly busy, but we will try to do whatever we can to help increase diversity in our field. We definitely want to thank Dr. Matthews and the folks at Tour for Diversity for setting this panel up. I know it's going to be extremely beneficial. It's going to be available on their YouTube channel. So if if I mumbled and talked too fast and you want to review that, you can go to the T4D Tour for Diversity YouTube channel to replay this, and then you can send it also to your colleagues if they want to learn more. Visit my website, StephenBradleyMD.com, to sign up for our virtual anesthesia journal club. It's not to plug my website, there's really nothing on it, but to streamline the process, you can sign up there to get an email when we have our journal club. You can come and learn about anesthesia and help build that network. Another shameless plug before I let Dr. Milam close us out. I do host a podcast, a Black Doctors podcast. Next month, we are having a takeover. We're hosting actually the Tour for Diversity. They're going to come because we're so closely aligned, or we so very much support the efforts and the work they're doing. You're going to hear from Dr. Matthews and a host of other people from Tour for Diversity. And every Monday, there's going to be an episode featuring somebody from an organization and giving more advice on mentorship and time management and being a Black or Latinx physician. So tune in next month for the Tour for Diversity and the Black Doctors podcast. Dr. Milam has posted some amazing resources throughout this talk. So would you mind taking us home and closing us out for this evening?
Thank you, everyone, for joining in, and thanks for having me. Excited to be here, and definitely use us as resources and as possible mentors. If you reach out to us, if we're not free at the time, we have other colleagues that we can connect you with. But it's really important to network and connect with mentors. This is a very difficult and stressful process, but we all made it through, and so you guys will as well. But we can connect you again with possible mentors, our colleagues that will you might see on the interview process and the interview trail. So don't go through this alone. This is not the time to do this alone. Use your resources and your mentors as you submit your application and start interviewing. Thank you.
All right. Thank you all very much. You're going to end the recording and sign out.